Good morning, everyone. I'm Jen Smith, Secretary for Pennsylvania's Department of Drug and Alcohol Programs. Thank you so much to South Central EMS for hosting us today to talk about the importance of carrying the overdose reversal drug Naloxone and how each and every one of you can access Naloxone. Your members here at South Central EMS are truly on the front lines of the addiction crisis, and your service to the local community is invaluable. Here in Dauphin County, the South Central EMS participates in the Naloxone for First Responders program. Through that program, they are the centralized coordinating entity for this county, serving as the primary point of contact for first responders within their communities to request and receive Naloxone for free. I would also like to recognize Physician General Denise Johnson with the Department of Health, and Sam Cook with the Pennsylvania Commission on Crime and Delinquency, who are standing with me today as partners in the effort to get Naloxone into the hands of as many Pennsylvanians as possible. Expanding access to Naloxone continues to be a top priority for the Wolf administration. We're here today to highlight the numerous ways Pennsylvanians can and should access Naloxone, encouraging everyone to take advantage of one of those ways to get this life-saving resource and keep it on hand in the event of an emergency. Across the Commonwealth, local and state partners in the drug and alcohol field are working each day to keep fellow Pennsylvanians alive and to decrease the chances of individuals suffering a fatal overdose. These efforts have been amplified coming off a near record-setting year of fatal overdoses in 2020. The COVID-19 pandemic upended a lot of progress that we had made in recent years, but also allowed us to swiftly respond and intentionally respond to the challenges that rose to the surface during that time. We have made strides in expanding access to this vital resource, improving outcomes for individuals with substance use disorder. For instance, by working collaboratively with stakeholders, treatment providers, and advocates, throughout the pandemic, we have expanded access to drug and alcohol treatment services and life-saving harm reduction services like Naloxone. We learned that being able to use community-based services and having access to programs and resources are more vital than ever before. As I mentioned a moment ago, at the state level, the Department of Drug and Alcohol Programs and our partners within the Wolf administration are committed to continuing the fight to ensure all Pennsylvanians have access to necessary life-saving resources like Naloxone. As a whole, we know that in order to reduce the human and economic impact of the disease of addiction, we must confront the devastating effects of stigma. Stigma reduction is at the core of my department's four-pronged strategy that outlines our goals and work toward recovery. We can no longer talk about suffering from a substance use disorder or an overdose as a moral failing. Increasing awareness of and access to Naloxone is one important strategy for reducing stigma. It is, after all, a medication that saves lives, and that fact can't be disputed. The harsh reality is that none of us know when we might come across an individual who is suffering from an overdose. It could happen at home, at work, at the bus stop, at a recreational event, and we need to be prepared. Again, Naloxone saves lives, and the more Pennsylvanians who have it in their homes, their vehicles, their briefcases, their handbags, the more we can normalize the accessibility of Naloxone and demonstrate the desire to help our fellow Pennsylvanians who are struggling with substance use disorder. Remember, it is a medication that saves lives. If you're listening and wondering how you might be able to access Naloxone, I have a few options to offer. Individuals across Pennsylvania can watch a training video and receive naloxone free through the mail directly to your home through a state partner called Next Distro. Or you can use the Department of Health's Naloxone standing order to obtain naloxone at your local pharmacy. In addition, this past March, the Pennsylvania Commission on Crime and Delinquency announced the availability of the statewide Naloxone Allocation Request Portal. The portal allows eligible organizations serving high-risk populations the ability to request naloxone nasal spray, which I'm sure Sam is going to speak more about in a few minutes. With these resources, all residents of Pennsylvania who are at risk of experiencing an opioid-related overdose, or who are family members or friends who are in a position to help someone at risk, can now get naloxone no matter what. Please take advantage of whichever method of getting naloxone works best for you. Links to the ways that I outlined previously are available by going to the Department of Drug and Alcohol's website at ddap.pa.gov and clicking on the link for Get Naloxone. I am now pleased to introduce Dr. Johnson from the Department of Health, who will share more about the importance of the Department of Health's standing order. Dr. Johnson?
Good morning, everyone. And thank you so much, Secretary Smith and Central EMS. We're glad from the Department of Health to be here to partner with you on this really important initiative. So I'm Denise Johnson, the Physician General at Pennsylvania Department of Health, and today I want to talk about one of the greatest tools that we have in this battle against opioid overdoses, and that's the naloxone, as you've heard. The Wolf Administration and many other state agencies have taken significant action over the past several years to address the opioid and substance use disorder crisis through the Opioid Command Center, and more recently through the Interagency Substance Use Response Team, or simply Response Team. Together, the Wolf Administration Opioid Command Center and the Response Team have worked diligently over the years to address the ongoing opioid crisis through 4 main focus areas: prevention, rescue, treatment, and recovery. And in fact, from January 2018 through August 2021, Governor Wolf signed and renewed the Opioid Disaster Declaration a total of 15 times. And even after the declaration expired, the administration has continued to show commitment to helping individuals who are struggling with substance use. And one of the ways that we're doing that is by issuing this standing order to ensure that all Pennsylvanians who are at risk for overdose from opioids, or who have family members or friends, or might be in a situation where someone is at risk for overdose, has access to naloxone. I signed this order because we know that substance use disorder and overdoses are at risk for people throughout the Commonwealth, no matter what community you live in. It's a priority for the Wolf Administration to ensure equal access to treatment, including naloxone, at pharmacies and other facilities across the Commonwealth. Since the launch of the naloxone for first responders that you heard from Secretary Smith, the centralized coordinating entities have distributed 114,069 kits, and each one of these kits has 2 doses of Narcan to first responders across the Commonwealth. 29,578 kits were distributed in 2020 alone. And these efforts have resulted in more than 19,138 overdose reversals. And this includes 5,282 reversals reported in 2020. Additionally, in March, the Opioid Command Center announced the availability of the Naloxone Allocation request portal that you heard about that allows organizations to access this for high-risk populations. Naloxone is convenient to carry and to keep on your person, and it takes very little effort to administer. To administer it doesn't require any specialized knowledge, and you can learn how to do this in just a couple of minutes. When it's used as directed, it is fast-acting and it can save a life. Now I'm going to turn over to Samantha Cook, and thank you all for remembering that by carrying naloxone, you have the ability to save someone's life. Thank you.
Right. Well, thank you so much, Dr. Johnson, and good morning, everyone. I'm very pleased to be here today on behalf of the Pennsylvania Commission on Crime and Delinquency, or PCCD, as we're more commonly known. Established in 1978 through Pennsylvania state law, PCCD's mission is to enhance the quality, coordination, and planning within the criminal and juvenile justice systems, to facilitate the delivery of services to victims of crime, and to increase the safety of our communities. As the Commonwealth's Justice Planning and Policymaking Agency, PCCD is proud to support a number of initiatives that center on prevention, intervention, treatment, and recovery for justice-involved individuals and others in Pennsylvania's communities. These efforts include coordinating distribution of life-saving overdose reversal medication statewide through our Naloxone for First Responders program. As was mentioned, launched in November 2017, the goal of this program is to increase the availability of naloxone for individuals at greatest risk of opioid overdose, as well as the systems that are most likely to interact with these individuals. The program provides no-cost intranasal naloxone, or Narcan, to priority first responder groups through a network of 48 centralized coordinating entities that serve at the county and regional level. We affectionately call them CCEs, and they serve all 67 of Pennsylvania's counties. You can learn more about this initiative by using PCCD's website at pccd.pa.gov. Since the program's inception, as Dr. Johnson noted, CCEs have distributed more than 114,069 kits of Narcan to first responder groups, ranging from law enforcement and EMS to grassroots harm reduction organizations to treatment centers and beyond. These collective efforts have resulted in at least 19,138 overdose reversals statewide to date reported by CCEs. Thanks to the strong commitment of the Wolf administration and the support of our sister agencies, most particularly our partners, our funding partners at the Department of Drug and Alcohol Programs, we have been able to significantly increase the scope of our naloxone distribution efforts in recent years. In March of this year, the Wolf administration announced the availability of a new statewide portal that gives community-based organizations serving high-risk populations another option to request no-cost Narcan beyond what is already available through their local CCE. PCCD has also supported operation of the state's new mail-to-home program, which is managed by Prevention Point Pittsburgh and Next Distro, as Secretary Smith noted, giving individuals yet another vital access point for obtaining this medication for themselves or a loved one. Recognizing the significant intersections between criminal justice involvement and substance use disorder and the heightened risk of overdose death for recently incarcerated individuals, earlier this year, PCCD also partnered with the Pennsylvania Sheriff's Association to support a new county jail naloxone reentry initiative, which focuses on providing Narcan for individuals leaving jails and returning to the community. PCCD remains committed to the distribution of naloxone throughout the state to prevent overdose deaths and save lives. And while PCCD serves as an administrator for this program, the program's impact is truly made possible through the daily work of groups serving on the front lines of this crisis. That's why it's a real honor to be with you here today at South Central EMS, which serves as the centralized coordinating entity for first responders in Dauphin County, and to get to introduce you to Jason Campbell, who leads these efforts for the agency. South Central EMS is a lifeline in the community in so many ways and plays a critical role in making second chances possible through its naloxone administration, distribution, and leave behind efforts. We are very proud to serve as partners with them in this life-saving work. And with that, I will turn things over to Jason for a few remarks. Ooh. Hey there.
Thank you, Sam. My name is Jason Campbell, and I am the Chief and CEO of South Central Emergency Medical Services. South Central EMS serves as the CCE for Narcan distribution for Dauphin County. Over the years, South Central EMS, in conjunction with DDAP and PCCD, has distributed over 3,000 doses of Narcan throughout Dauphin County, but we can do better. Within the past year, Dauphin County has seen an increase in opioid cases, whereas one overdoses with an opioid substance. Narcan is available through South Central EMS for first responders, physician offices, and other facilities geared toward combating the opioid crisis. South Central EMS has an ample, and I do repeat, an ample supply of Narcan to be distributed throughout Dauphin County. To obtain Narcan, simply contact South Central EMS at area code 717-671-4020 and complete the minimal paperwork to receive your requested amount of Narcan. Thank you.
Thank you, Jason. Can't say it enough how much we appreciate the work that you are doing directly in the community. We say this all the time at the state level. We get the funds and we make some of the policy decisions, but the true impacts for citizens happen at the community level. And without partners like South Central EMS and others across the state, we wouldn't be able to get Naloxone into the hands of all the people who need it. So a huge thank you again, Jason, to you and your organization. So as we close and before I open things up for any questions, I would be remiss if I didn't mention the state's Get Help Now hotline that's available for anyone who is struggling with substance use disorder or their family members. The hotline number is 1-800-662-HELP, and it's available 24 hours a day, 7 days a week, 365 days a year. As we're heading into the holiday season, which can be a joyous time for many people, it can also be a very difficult time for individuals with substance use disorder. We often see substance use increase during the holiday season. So I want to stress again that this hotline is available every single day of the year, every hour of the day. And again, that number is 1-800-662-HELP. Please use the resources that are available to you, like the Get Help Now hotline and the availability of Naloxone that we talked about today. Remember, it is free, it's available, and it's a medication that can save a life. Thank you so much, and at this time, I will open it up to any questions that we might have. Okay, hearing none, that'll conclude our event. Thank you so much.